Good evening, everyone, and welcome to Fitness Solutions Balance, Flexibility, and Therapeutic Exercises for Arthritis. My name is Ashley Davis, and I am the founder and online coach for RA Warrior Fitness. And so RA Warrior Fitness empowers women living with rheumatoid arthritis to improve their quality of life through faith, food, and fitness. I started that business as I am a 17-year arthritis warrior. I actually have rheumatoid arthritis. And so in my journey of trying to, get healthy myself and to lose the 60 pounds that I gained because of arthritis, I knew that there were other women out there like me who wanted to improve their quality of life as well. So that's my mission. So now I would like to actually introduce our guests. Sabrena Jo. Sabrena has been actively involved in the fitness industry since 1987 as an ACE certified group fitness instructor, personal trainer, and health coach. She has brought group exercise and owned her own personal training and health coaching businesses. Sabrena is a former full-time faculty member in the kinesiology and physical education department at California State University, Long Beach. She has a master's degree in physical education, biomechanics from the University of Kansas, and is currently pursuing her PhD in exercise psychology. Say hello, Sabrena.
Hi, everyone. Great to be here.
All right, and now we have Dr. Steffany Moonaz. Dr. Steffany founded Yoga for Arthritis after 8 years at Johns Hopkins University, where she studied the effects of yoga for people living with arthritis. She now serves as the Director of Clinical and Academic Research at the Maryland University of Integrative Health, which offers the nation's only Master of Science in Yoga Therapy. She continues to conduct research on the effects of yoga for chronic pain and joint conditions and mentors yoga teachers, yoga therapists, and emerging researchers. Say hello, Dr. Steffany.
Hi, everyone.
Welcome. Now, lastly, we have Dr. Paul Lamb. Dr. Lamb is actually joining us from Australia. So Dr. Lamb is the creator of the Tai Chi for Arthritis program, a family physician and world leader in the field of Tai Chi for health improvement. The Arthritis Foundation and Centers for Disease Control and Prevention support his program. Millions of people have gained health benefits from his program, and Dr. Lamb's instructional DVDs and books are global bestsellers. Welcome, Dr. Lamb. Thank you so much for joining us, everyone. So before we get started, I just want to preface that physical activity is one of the best non-drug ways for managing pain and stress. A balanced fitness routine is one that incorporates strength training, balance, flexibility, and cardiovascular activity. However, tonight we'll be focusing specifically on balance, flexibility, therapeutic exercises, which are all key for keeping your joint tissue healthy with arthritis. So let's get into it. Let's get started. So our first topic tonight is getting started with flexibility and balance routine. But before we dive in, let's first define therapeutic exercises and how they are important for arthritis. So Steffany, would you like to kick us off?
So what Dr. Lam and I both offer with our programs, Tai Chi and yoga, you could consider them under the umbrella of therapeutic exercise, but they're mind-body practices. So they're more than limited to physical activity. They're whole person practices. And I think that's an important part of what makes them therapeutic, because exercise in and of itself can be therapeutic, but not all exercise is therapeutic exercise. Similarly, you could have a yoga practice, for example, that actually is not therapeutic. In fact, it's possible to be harmed in a yoga practice. And I'll let Dr. Lam speak to whether that's the same with Tai Chi. And so it's really important for people with arthritis to find practices that are safe and appropriate and geared toward them. What is therapeutic or beneficial for health outcomes for one person with arthritis is not necessarily the same as what's beneficial for health outcomes for another. So it's also important that it be tailored to not only where you are in your arthritis journey, what joints are affected, how severe the disease is, and the type of arthritis, but your level, your age, your level of physical fitness, and all of that. So what makes exercise therapeutic can really vary from person to person.
Right, because there's no one size fit all for, each patient. They're different. I can definitely agree. So Dr. Lamb, if you would unmute yourself, is there anything you would like to add to what Dr. Steffany just said?
First of all, I really agree with Steffany that Tai Chi and yoga is a mind body exercise, which is really important. In fact, the mind is more important in some way than the body. And that not all Tai Chi, especially not all Tai Chis, because there were a segment of Tai Chi who specialized in martial arts. It's not really so therapeutic. So it's important to choose the right Tai Chi that is safe and therapeutic and evidence-based. And then you're much safer and get what you need. Yeah.
Right. All right. Thank you. Thank you for that. So Sabrena, you have a master's in biomechanics. So can you define that term and how does it play a role in flexibility and balance?
Sure. So biomechanics is a science in kinesiology where we study the internal and external forces that act upon the body and in the body and how they affect the joints and movement. And you can, in biomechanics, specialize in maybe athletic pursuits or injury prevention or even post-rehab and rehab type of exercises. And it just depends on, what you're interested in and where you actually pursue. I was always interested in helping people move better and feel better and just be more physically active. And so from my perspective, where biomechanics comes in is in flexibility. You really want to have an equal amount of muscular strength and also joint flexibility in order to move your body well and move your body comfortably throughout its intended ranges of motion. And so in my practice, I like to help my clients with both strength, cardiorespiratory, but then also the neuromotor and also flexibility. So I know we're parsing out flexibility and balance in this conversation today, but of course it's all very important. It's all integrated and interrelated.
Absolutely. So getting started with a flexibility and balance routine, let's talk about that a little bit. So what are the best types of physical activity to promote flexibility and balance? Sabrena, would you like to weigh in first?
Yeah, so one of the best things that you can do for the health of your joints is to move them often through their intended ranges of motion. And some people think about flexibility as stretching, and that's true, static stretching, dynamic stretching, but also really any movement that you can do throughout its full range of motion will be, as long as it's appropriate, will be healthy for the joint. And so I like to think of flexibility as just being able to move with your intended range of motion pain-free and be able to do the things that you want to do in your life. And whether that be physical pursuits like, athletics, or whether it just be things that you do in your activities of daily living. And so when I help my clients with mobility and flexibility, we always look at their goals, of course, and then we always want to do exercises that, whether it's stretching or just body weight movements or even balance exercises, that they do in their safe, pain-free ranges of motion, but they do it often so that they keep the joints mobile.
Right. Love that. So when structuring an exercise program for a new client, what type of activities do you suggest? Dr. Moonaz, would you like to weigh in on that?
Sure. So my focus as a yoga therapist is going to be on developing a balanced yoga program that incorporates all of the elements that Sabrena is talking about. So, there are yoga practices that are very much focused on stretching, as she mentioned, that you spend long periods of time at the end of range of motion in order to lengthen the tissues. And if that's all you do, then you're going to lack stability. And so especially for someone with arthritis who may be lacking stability in the joint, it's really important that it also incorporate strengthening poses that help to engage the stabilizing muscles. It's important also to include balancing postures, which, I'm sure we'll talk about this a little bit more, but balance is key to not only reducing the risk of falls, but also reducing the fear of falls, which can limit the kinds of activities that people do and therefore reduce their physical fitness. And engaging the cardiovascular system, many people don't think about that when it comes to yoga, but yoga also includes moving sequences like the sun salutation, for example, that do engage the cardiovascular system. So incorporating some of all of those elements of physical fitness. And then, as Dr. Lamb was discussing, it's a mind-body practice. So we're thinking about ensuring that we're engaging in mindful attention throughout the practice, that the breath is incorporated with all of the movement, that there is an awareness of thoughts and feelings that might arise through the practice, that there is intention for how to engage in that practice and relate to any pain that does arise. For example, Sabrena said something about being free from pain, which is ideal, but not necessarily possible. So we do want to make sure that we're not doing movement that exacerbates pain, or especially pain that is sharp or shooting, etc. But sometimes in a practice, we will not be free from pain because there is a level of baseline chronic pain that's sort of always there in the background. And so a part of a mind-body practice is, what do we do with that information? How do we respond to it? How do we relate to it? And how do we keep ourselves safe in the context of that pain?
Right, that makes sense. So Dr. Lamb, what are the top issues or questions to address before getting started with the flexibility routine to protect your joints? What would be one of the first questions you would ask your patient?
That is the medical condition. And the first thing we want them to do is work very well within their comfort zone. And that is how I design our program to be really safe and stretch and strengthen the whole body, especially the balance, because Tai Chi is all about balance. So one of the important things is that we use the mind. So we tell our participants to do what the movement technique, but well within their comfort zone. Whatever they cannot do, they visualize. And by visualization, you actually activate the blood circulation. You actually have the exercise. The muscles get exercised to 20% of the physical exercise. And that often helps them to improve their stretch, their strength, without actually doing that far. So in safety, and also we put our Tai Chi into normal life. Sabrena was talking about normal activities. Being active is very much part of the therapy.
Right. Keep moving. That's right. So what credentials would one look for in a yoga teacher or a Tai Chi teacher? Like, what credentials would we need to look for someone who wants to get started?
I'll answer that for yoga, and then he can answer it for Tai Chi. So there is a basic level of training that is required for a yoga teacher to be registered, which is 200 hours of training. When someone has 200 hours of training, they are barely learning how to teach yoga to a healthy population. They are unlikely to be learning how to modify yoga for people who have movement limitations, or to take into consideration any kinds of contraindications red flags or safety concerns that may be at play for a therapeutic population. Mm-hmm. There are additional yoga teacher trainings that people can do to become more specialized. And so if you're searching for a yoga teacher, you want to look for someone who has additional training and experience working with people who have your condition. Mm-hmm. There is also a credential of a yoga therapist, and that's a minimum of 1,000 hours. And a yoga therapist is trained to work in clinical settings, in hospitals, in integrative health clinics. And so they do have a general understanding of safety and care plans and how to collaborate with healthcare personnel, et cetera. But even a yoga therapist can further specialize. So for example, I'm a yoga therapist. My specialty is in arthritis and chronic pain. And so you can find someone, either a yoga teacher or a yoga therapist, who specializes in that area, and ask questions about the kind of yoga that they offer and whether they do feel comfortable adjusting the practice, individualizing it, communicating with your doctor, et cetera.
Perfect. Dr. Lam, what about for Tai Chi? What is something someone should look for as far as credentials?
Especially for people with arthritis, it's important to find someone who's trained to do that. Mm-hmm. And as far as I know, the Tai Chi for Health Institute have a very clear standard of training, and we really taking care of people with medical conditions, especially people who are certified to teach Tai Chi for arthritis. I train lots of physical therapies and occupational therapy, so they would be a good people if they know Tai Chi and being a exercise physiology like Sabrena. These people would be great. A lot of yoga teachers as well, they would be also a good alternative. I don't think we have a really well organized system of training outside the institute around the world in USA. So I think people should, if they can't find one of our instructors, and I think Arthritis Foundation have the list of our trained instructors, they should go to the class and get to be there and watch the teacher to see, look at the participants. Are they like you? Is the teacher caring? Is the teacher comfortable with people with arthritis? And then make a careful decision.
Right. That makes perfect sense. Thank you so much for sharing that. So mind-body exercises, let's talk about that. So what does the evidence say about mindful movement to improve balance, flexibility, and joint health with arthritis? Dr. Steffany, would you like to weigh in on that?
Of course, I'm going to want to speak to my own research. Looking at the effects of yoga. So certainly, oftentimes what people are most interested in when they come to yoga for arthritis is reduction in pain. And absolutely, we see about a 30% reduction in pain with an 8-week yoga program, as well as improved physical fitness. So improved balance, strength, flexibility, because people are moving more, they're going to gain all of those aspects of physical fitness. And what's important is they're doing that in a way that's safe and appropriate. Because people with arthritis starting an exercise program that is not tailored to them may not end up with gains, because they might end up, with increased pain or with injury. Additionally, because it's a mind-body practice, and a lot of the practices within the umbrella of yoga are intended to change the way that we think and feel, we see reductions in some of the mental health concerns that are common for people living with arthritis, such as depression and anxiety. So we see improved stress management, reduced depressive symptoms, and improved quality of life. In addition, people's confidence in their ability to manage their condition and their ability to be physically active improves. And anecdotally speaking, while we don't necessarily have quantitative data on this, people report changes in their outlook, changes in the way that they think about their body, they think about life with arthritis and what that means for them going forward, so that the new normal is not a negative, but it can be an opportunity to learn from living with this condition, such that there have been people in our studies who have said, I am glad that I have arthritis, not because of all of the challenges associated with it, but because I would not have become who I am had I not been through the journey of having to come to terms with it.
Absolutely. I can certainly attest to that on a personal level, because I truly feel like mindset is so important, when you can focus on the positive, because I tell my clients all the time, focus on what you can do instead of, what you can't do, because my RA is specifically in my wrist. And so I used to beat myself up all the time because I couldn't do push-ups. But, there's a modification for everything, so I just focused on what I could do and did more of that. So I can certainly agree with that. Thank you so much for sharing that. So what about evidence for Tai Chi, Dr. Lam? What does evidence say about the mindful movement to improve, joint health for arthritis through Tai Chi? Oh, you're on mute, I believe, Dr. Lam.
Is that better?
That's better. Thank you.
There's over 1,000 studies being published about the benefit of Tai Chi. So there's a lot of also evidence on Tai Chi for arthritis. And let me mention 2 studies. The first study was conducted by University of Carolina by Professor Lee Callahan. I believe she did a lot of work with people with arthritis. And that was the world's largest study for Tai Chi and arthritis. She had 354 subjects, which is a lot, and divided into Tai Chi and education. And within 8 weeks, I thought that was amazing. 8 weeks, 2 classes a week. End of the 8 weeks, and it was compared with people who didn't do Tai Chi. And the outcome was people have significantly less pain. They can do a lot more, do more shopping, walk longer, and so on. And their balance is better, which is good for prevention. But the most important thing for me is that people feel better at the end of that 2 months about themselves. So that's a great study, 8 weeks.
Absolutely.
That's the other study was done in Sydney, funded by our health department, which is very unusual for them to find such a good things. And they study 702 people. Mainly, they're looking for people's strength, feeling better, but mostly falls prevention. And that's found the Tai Chi for Arthritis program has reduced the rate of fall by 67%. So that's quite amazing. 2/3 of people, and there are people over 65, so they're all older adults. Apart from that, they have better muscle strength and so on. So one of the most important things, you were talking about mind body exercise, is that study found, there are studies who show when people are in fear of falling, they're more likely to fall, especially people with arthritis. They're more likely to fall. But that study found the people who done Tai Chi, after they done Tai Chi, they feel more confident about their balance and not so in fear of falling. And that is one reason the mind is so important about the benefit. Yeah.
Right. Thank you so much for that. So here's what I'm interested in are common modifications. So we'll talk about common modifications for yoga, like for the wrists, shoulders, back, knees, hips, and ankles. Are there any tools or devices that can help with yoga practice that are arthritis friendly? So Sabrena, feel free to weigh in on this one if you'd like, or
I actually would love for Steffany to answer the yoga specific questions.
Okay.
But I just wanted to weigh in a little bit on what, both Paul and Steffany said, because one area that I'm studying right now for my dissertation is exercise psychology. And what I can tell you is that the vast amount of evidence shows that being physically active, regardless of what you're doing, but being physically active definitely produces an increase in mood. And that's one of the things as an exercise professional that we really want to focus on, because having a better mood and just, feeling just psychologically better about yourself and about your environment, that can happen pretty much instantly in the first movement session. That's something that we want to promote and focus, because sometimes the other physical changes are lagging. Sometimes it takes months to see improvements in strength and flexibility and even in pain management. So if you can really focus on the positive aspects of what happens during a session, because usually you leave a session that's really tailored to you and your needs, in which you move well, you usually leave that with a very positive mood. And you really can't say enough about that, in my opinion.
So true. So true. Thank you so much for weighing in on that, Sabrena. So going back to the modifications. So Dr. Steffany, what are some common modifications for yoga, popular yoga poses, focusing like on the wrists, shoulders, back, knees, hips, and ankles?
Yeah. So, one of the challenges with a yoga practice for people with arthritis is that, unlike Tai Chi, there are a lot of practices that bear weight in different major joints of the body. So weight bearing on the hands, weight bearing on the knees, right? And that can cause discomfort. But there are a lot of things that I teach teachers to offer, and I'm not alone in doing that there is no one shape that makes something yoga. Yoga means union, and it's a unification of the mind and body, a unification of movement and breath. And so your body doesn't have to be in a certain position for that to happen, as long as it's a position that is healthy for your body. And it really depends on what are you trying to accomplish with this particular pose. So there are some poses that are for strength, for balance, for flexibility, for qualities of mind, like surrender or empowerment, right? So we want to find an alternative that's going to still foster those benefits and that experience, but that's safe for the body. So there are certainly yoga props, that are sold as yoga props. So things like a block, a strap, a special yoga blanket. There's a wedge that I like to use a lot for wrists and ankles. But you can also use household items, especially now during COVID, that lots of people are practicing yoga in their own homes over Zoom. I encourage people to use things that they have lying around the house, like fold a towel, get, a throw pillow off of your sofa. A chair is a phenomenal prop. A standard folding chair, you can do so many things with, standing behind it, holding on, sitting in it, and even the wall. So there are lots of things that we can do up against a wall, and, changing the relationship to gravity. So instead of having the hands on the floor, you take that same pose and you have your hands on the wall, and then you're not working against gravity. So, we can flip poses upside down. There are lots of creative things that we can do, but you really have to work with someone who feels comfortable and confident doing that.
Absolutely. I agree 100%. So, Dr. Lam, what about with Tai Chi? What are some common modifications for those same joints, such as the wrist, shoulders, back, knees?
Absolutely. Can I first of all saying that how much I like Sabrena's talking about moods and starting. And Dr. Lee Callahan's studies show one of the things was people feel better about themselves after Tai Chi. So that's what I see. Whenever I go to a class, people feel better. And I learned something from Steffany. I didn't know yoga means harmony. That's like really what Tai Chi is. It's about harmony and balance. So there are so many types of Tai Chi and so many ways of teaching it. It is easier for me to say that our team designed the Tai Chi for Arthritis to be safe. And then we train our instructors to not just teach it safely, but also understand how to take care of people with arthritis. So there are just seemingly harmless movements that actually have a lot of stress. For example, a lot of classical Tai Chi people put weight on the knee and then turn their knee around, that grind on the knee. So we don't do that. We take our weight back and then you turn. So that way there's no grinding force on the knee. You still get the exercise. And that's it's sort of what we do throughout everything I taught and all the instructors we train and build right into the system. So it is safe. We take away anything with high risk, especially being a doctor who have arthritis for 60 years. I really understand what has risk. So is that good enough? That's easier. It's very hard because there's so many ways to do Tai Chi. Yeah.
Yes, yes. Thank you. Thank you so much. So we have a question from our Facebook viewers for Dr. Steffany. So what about improving balance with the tree pose and other yoga postures? Oh, you're on mute, Dr. Steffany.
Thank you for reminding me. A lot of the poses in yoga that are considered balancing poses are done standing on one foot. Okay. And tree pose is one of those. It can be challenging to stand on one foot, especially if you haven't been doing anything to work your balance. So one of the things that I suggest is starting out by standing on 2 feet as a balance. The wider your stance is, the more stable it is, but you can play around with that, standing at a wall, standing at a chair, holding on to it, lift one hand off, see if you feel stable, try lifting the other hand off and grab onto it if you're starting to feel unsteady. But you can challenge that further by walking the feet closer together so that perhaps the feet are touching each other, and that becomes more challenging even though you're still on 2 feet. You can also challenge your balance by closing the eyes, hold on to the chair, close the eyes and see if you can take one hand off. So there's a lot that you can do to play with balance work without having to stand on one foot. That being said, poses like tree pose or eagle pose or warrior 3, those are poses that happen on one foot. And it is important that you maintain safety when you're practicing those. So holding on to something to start with until you feel nice and stable. We tend to practice yoga barefoot on a flat, hard surface like a wood floor so that we do feel, the proprioception of the surface of, the sole of the foot with the floor. But there are lots of ways that you can modify those poses. So for example, tree pose is often done with one foot against the other thigh. And that's really challenging. It can be challenging for the hip, challenging for the knee, maybe even the ankle. And it's not necessary that the foot be that high. So you can have the foot resting against the calf or against the ankle, just not against the knee where it would put pressure on the joint. So there are ways that we can modify. I was typing into our little private chat that you can even have a balancing pose seated. One of the things that we do for people who are unable to stand safely is sit in the chair in a tree-like posture and balance a yoga block on your head. And the muscle work that it takes to maintain that block on, anybody who's tried to walk across the room with a book on your head, that it does engage your postural muscles in a way that fosters balance. So you can be working on the skills of balance even before you're able to stand independently.
Absolutely. Thank you so much for sharing that. So before we go on to range of motion exercises, are there any other safety tips that you all would like to add about getting started with mindful movement routine? Or tips for preventing injury? Yes, Dr. Lena?
I
Go
think
ahead.
most importantly is that the people need to know responsibilities on themselves.
Mm-hmm.
They need to be really clear about within comfort zone, talk to health professionals so that they know how to take care of themselves. And of course, the instructors are very important. And that's
Mm-hmm.
how we train people how to take care. But we also want people to know it's your body. You are the best person to take care of it.
Absolutely. I couldn't agree more. Dr. Steffany, did you have something to say?
Yeah, I completely agree with Dr. Lam on that. I like to say you're the world's leading expert of your own body. So it's important to talk to your treating physician. So whether that be your rheumatologist or your primary care doctor who understands your disease, so that you can get any information about maybe things that you should avoid or things that you should be careful about, but also don't be afraid to say to the instructor, even, that doesn't feel right, that's bothering my knee, and modify to, a lot of people think, oh, well, the teacher's the expert, so I have to do what they tell me. But you're the expert of your own body. And so sometimes that means doing something a little bit differently than what the instructor suggests.
Mm-hmm.
Yeah, and I will add to that in that instructors who create a caring, task-involving climate, and by that I just mean the climate is focused on people who are there to improve themselves. They're not comparing themselves to others. They don't care about some scorecard or what their age group can do and they can or can't do. People who create, instructors who create that kind of environment and really show that they care, and then they also offer up an opportunity to communicate with their participants, those environments tend to support people better so that they keep coming back.
Mm-hmm.
And if a person feels very comfortable and successful very quickly, right away, then also they're more likely to come back. And if they have some autonomy about what they can choose to do in class because the instructor has given them options, again, a wonderful experience for both the instructor and the participant. So in terms of safety, absolutely, it has to feel right for the individual participant. And one of the ways to do that is to feel like you've got a good enough rapport and relationship with your instructor that you can understand, oh, these are modifications for me. And I'm very, I give myself permission to do them, even though they're different than what other people might be doing.
Mm-hmm. Absolutely. And I think it's so important for the instructor to, provide those modifications for the person, because I know what it's like to go into a class and want to do what everyone else is doing, but, just simply can't. And so before I, educated myself and became a certified personal trainer, I was always the one raising my hand, modification. But, when you do have someone that understands, it really makes a huge difference. So I completely agree.
Ashley, I love what you said, because you were brave and you raised your hand and you said, I need some modifications, but not everyone's willing to do that. And so It's important that the instructor makes people feel comfortable enough to do that and offers those modifications.
Mm-hmm. Absolutely. I agree. All right. Well, let's move on to range of motion exercises and balance exercises. So building balance is a part of an exercise routine that often gets overlooked. Why is fostering balance so important for all ages and not just older patients? Sabrena, I think this would be a great one if you would like to kick us off.
So, recent public recommendations for physical activity have now included something called neuromotor exercise, which is, you can think of as balance training. And this is a relatively recent update. This category wasn't added in previous decades, but it's important enough that you really do focus on balance type of activities or movements and drills that support balance, because we know that as we age, we're more likely to experience a fall if we don't have, appropriate balance faculties. And one of the things that people, I think, may not realize about balance training is that it can be as simple as, I think Steffany mentioned earlier, we do a lot of work in yoga on standing on one leg. But if you're not ready for that, you can do different widths of stances to challenge your balance. And when I think of balance, I think of really emphasizing gait or just our walking pattern.
Mm-hmm.
Our walking pattern is really just a series of standing on one leg and then almost falling before you get to the next leg. And really, walking is a great exercise for people to challenge balance if they feel unsure about it. Most people can walk, but if you don't walk and you don't walk in different terrains or maybe in practice in different directions, turning corners quickly, those types of things people may not think of as balance training, but it actually does apply because you're using all of these senses that actually contribute to balance. So your vision, your vestibular system, your mechanoreceptors in the joints. So certainly balance training can be thought of standing on one leg, but it's so much more than that.
Mm-hmm. Absolutely. All right. So how do range of motion exercises fit into a well-balanced flexibility and balance routine? Does anyone else want to weigh in on that?
I think Sabrena can start us off with that one too.
Yeah. Go ahead and kick us off, Sabrena. This is your wheelhouse.
So when we think about range of motion, that typically means stretching. So we want to introduce more mobility or degrees of freedom or flexibility at a specific joint. Then we would do specific exercises for that, which typically include stretching. And what the evidence shows is that static stretching, so something that you can do yourself, you don't need a special implement or a partner, just typical static stretching can be very effective over time if done appropriately and safely at actually increasing range of motion about the joint so that you can move without fear and you can move through your body's intended ranges. And this can be something, stretching and flexibility training is something that really can be done daily. And you can incorporate it in small segments throughout the day or just have a nice stretching segment in the beginning of your day or at the end of your day. So one of the things that I like to coach when I coach about stretching is you are your own best judge of how far to take it. You want to stretch to the point where it feels, oh, okay, I feel the stretch. I feel maybe this, if you want to call it discomfort of stretching, but it's never painful. So one of the things that is probably different though for a person with arthritis is how to think about, how to frame a painful joint when you're stretching. And so then I would kick it over to Steffany to talk about how she deals with people with pain.
I think, Dr. Lim, did you want to say something more before I respond to that?
Yeah, I love to talk about, and I'm okay. Can you hear me? Yeah. I love to talk about balance and stretching. It come together. And the thing about balance, that's what Tai Chi is all about. Not just the balance of the body, the weight, but it's the balance of the mind as well. And then, of course, earlier on, talk about the mind affect the body. So when you are more balanced in your mind, you're more balanced physically. And when you're more balanced physically, you're more balanced in mind. So in building that balance, everything we do in Tai Chi is about balance, physical and mental. And every time we move, we use the idea of how to balance. And that's how we teach our people to incorporate that when they walk. Sabrena was talking about walking. So whenever you can be mindful with the balance when you walk. So we put Tai Chi into their normal life. And Tai Chi is about stretching because when you stretch, it's a balanced way of stretching is also very important. So we do build into the whole movement of balanced stretching, and it's sort of really embedded part of it. Thank you, Steffany.
Sure. So I'll add to what we were saying about, stretching, particularly with arthritic joints, because, that when people are living with chronic pain, oftentimes they lose the nuance of sensation and being able to gauge what's sensation that is actually positive and helpful, and then what sensation that is harmful. In fact, oftentimes people with arthritis will sort of, shut off their connection to that sensation just to be able to get through the day. I can't pay attention to what I'm feeling because it's only going to get in the way, and I have all these things that I have to do. Or to the other extreme, they feel concerned about even the slightest bit of sensation. And so what I try to teach people is the difference between sensation and pain, and the different qualities of sensation that can give you a sense of whether or not it's positive. One of them being, was the sensation there already before you started the movement, right? If you walked into the class and your knees were bothering you, then your knees bothering you is not because of the class, right? And so that you kind of have to think about as background noise to an extent. But I also encourage them to think about, where am I feeling it? Do I feel it in the belly of the muscle, that thick part? Let's say you're, doing a forward fold where you're stretching the backs of the legs. Do I feel it in that really meaty part of the hamstring? Or am I feeling it in the backs of my knees, where I'm more likely to be stretching, the tendon than I am the middle of the muscle? So that, separate from, do I feel it inside the actual joint where my arthritis pain is? And that requires the mindfulness and the body awareness that both yoga and Tai Chi teach, to pay attention to, what am I feeling in this moment and how is it changing, without getting caught up in a doomsday story about it, without attaching all sorts of fears and narrative to it, but just saying, oh, okay, I'm feeling this. This feels a little bit dull and achy, and I'm feeling it in my quadriceps muscle group, or whatever it may be. So understanding, where it is, what the quality of the sensation is, and the intensity. Okay, as I go deeper into this, now it's starting to cross over from being dull and achy to being more sharp and shooting. And so now I know I have to back off. And that's an important skill for arthritis management every day, not just during physical activity.
Absolutely. Thank you for that. So we do have a question from our audience, someone that has knee arthritis. Any thoughts on cycling? And is yoga or Tai Chi better? Any thoughts on that? Cycling?
I mean, I'll say something about it, and I'm sure the others may want to add also. You could use what we just talked about with that sort of calculus of, when I cycle, where do I feel discomfort? Is it making my legs tired because they're working hard and I'm feeling it in the muscles, or is it bothering the arthritis in my knees? And some people find that if they make adjustments to the bike, it can reduce the amount of flexion that's happening in the knee. Some people like a recumbent bike, and they have recumbent bikes that are not only stationary, but you can also get recumbent bikes to ride around town. And sometimes that helps because it reduces the knee angle and also the angle at the hip, and also can be more comfortable for the back. And I don't think it's necessarily an either or, do I cycle or do I do a mind body practice like Tai Chi or yoga, because they bring different benefits. And so I think ideally, we have a variety of different activities that we do on a weekly basis that are incorporating things like cycling, or like a brisk walk, or like a swim that's going to be more cardiovascular, and then something like one of our mind body practices that is going to do more to build balance and flexibility and some of those mindfulness elements.
That's right.
I love cycling, and I love Tai Chi, of course. So we are being locked down now. I put the bike in my car, I take it to the park, and I cycle there. So all the things Steffany talk about applies. Take care, be aware, and it's a beautiful exercise for arthritis of the knee. Certainly that's one of the worst part of my arthritis. I have osteoarthritis for 60 years, and I used to have problem walking, but not anymore.
Yeah, so you enjoy riding your bike. That's awesome.
I'll echo what everyone said so far, and I will add modifications to your seat height and how you pedal will change the flexion of the hip and the knee. And if you pedal with mainly the ball of your foot, you will notice more pressure in the knee. So I might suggest, if you're on a stationary bike, maybe trying to pedal more with the heel instead of the ball of the foot, because then the forces, you really do use more hamstrings in that situation, which actually tend to support the knee a little bit better in that position. So I don't know if I'd recommend it if you're out on the road pedaling with your heel, but if you're in a stationary bike or a recumbent stationary bike, maybe pushing through the heel might offer up a little bit of pressure off the knee.
That's a great tip. Thank you, Sabrena. So what are some common range of motion exercises to improve strength and balance? Can you think of any off the top of your heads, like common range of motion exercise that anyone can do?
Well, I can chime in here a little bit. When I'm helping a person with arthritis or someone who wants to achieve greater balance and flexibility, I tend to think of 5 primary movement patterns, because if I can help a person move in some very foundational ways, whatever we do together in our session hopefully will generalize to outside of the gym or the facility, and that they'll be able to carry over. So things that I like to do really mobilize the major joints of the body. So the first thing I can think of would be anything that would mimic a squat or a stand up and sit down motion. And what I love about this is you can get different heights of chairs to match whatever your ability is, and do that type of sitting down, standing up, or squatting motion is great for the hips, knees, and ankles, believe it or not. And then also another range of motion exercise would be think of a single leg type of movement or a lunge movement. And again, those things can be done holding onto a wall or a chair if you feel like your balance is, compromised, or you're not quite comfortable, but, lowering to a depth in a lunge in different planes. So maybe a forward lunge, then a step to the side. Things that change direction will also help with mobility of the lower body. So ankle, knees, and hips again. And then anything that you can do for the major shoulder movements. So any pushing, any pulling, doing that on a regular basis with either no weight or a very light weight that you can tolerate. Great for that joint that hopefully doesn't produce pain. And then any type of rotation. So any type of rotation which could translate to your whole body rotating through space, or maybe just your spine, or rotation of the limbs themselves. So when I'm helping people gain greater function and mobility, I'm always thinking of kind of those 5 basic foundational patterns. And oddly enough, all those things happen in yoga and Tai Chi.
I love that. All works together. So we do have another question from the audience. What are some seated exercises for flexibility and balance and range of motion? I know that you just mentioned one, Sabrena, with the stand up, sit down, but are there any other seated exercises that could be done that you all can think of, Dr. Lam?
Yes, we created seated Tai Chi for arthritis, but I also want to answer a bit of what Sabrena was talking about. It sounds to me like she's talking about Tai Chi. We do Tai Chi with knee bend within your comfort, so that the knee, the quadriceps, the hamstrings, and we do stretching of the shoulder, to move the whole body really. So yeah, either you know Tai Chi or very good at similar theories.
And all of those are in a standard yoga practice too. The lunging, the squatting, the rotation of the trunk, and so yeah, they're all whole body practices. And of course, there's chair yoga as well. I will caution that when something is billed as chair yoga, sometimes the entire class is seated and it's suitable for anyone who is chair bound. And sometimes chair yoga means that a chair is used in the class as a prop, which means that maybe a portion of the class is seated and then there's some standing and holding onto the chair. So when you see chair yoga, you really have to inquire about how much mobility is required. Additionally, some chair yoga classes are appropriate for a wheelchair and others are not. So that, some chair yoga classes, there may be instruction that requires you to be able to turn sideways in your chair, for example, which cannot happen if you're in a wheelchair. So making sure that that the class is appropriate and the chair is appropriate for that particular chair yoga class.
Perfect. All right. Thank you. Thank you. So before we move on, let's talk about dynamic stretching. So what about dynamic stretches before other types of activity? How can these help decrease injury and promote healthy joints? I'll leave that out there for anyone who wants to address it. Dynamic stretching.
Well,
I can chime. Please go, Dr. Lam.
If dynamic stretching is what I thought it is, then we got to be very careful. People with arthritis, you got to make sure you warm up properly and really understand what you're doing. All the things we talked about just now about precautions, they got to take into consideration.
Mm-hmm. Absolutely. And so would you all say that, what are some examples of dynamic stretches for different types of activity? So let's just say walking. What would you say is a good dynamic stretch before walking?
Oddly enough, the things that I mentioned earlier, like the squatting and the lunging, can be thought of as, that's why I called it a range of motion category, because it can be thought of as like a pre-exercise activity to get the joints and muscles warmed up. Another great example besides walking might be swimming. So before you actually engaged in the act of swimming, you might do some small shoulder circles on land or even in the water before you start, in a small range of motion to start. And then maybe after a minute or so, try larger, and then maybe try lengthening your lever.
Right.
Because those things incrementally increase the challenge on the joint, and it does prepare the joints that you're getting ready to use. So swimming, shoulders, we think, a lot of that, the shoulders, but also the core. So really dynamic stretching is moving the joint through a range of motion slowly and carefully, but not stopping for that static hold.
Right.
And what the evidence seems to show is that the long hold, like holding for 30 seconds on a stretch, is probably best reserved for when the body's already pretty warm, like maybe towards the end, the relaxation part of the stretch. Whereas the dynamic stretching, a great example is the shoulder circles. That's something to add before you begin your activity, because it prepares the joints and the body and the mind to prepare for what's about ready to happen.
So in yoga, we would call that vinyasa, which is the moving sequences that usually happen, at the beginning. You have some centering and some breathing, and then you move into some whole body activities, lunging, stretching, reaching, getting the whole body warm before you would do anything like folding forward and, spending 5 breaths in a particular pose. I think that when people hear dynamic stretching, especially maybe those of us who grew up in the 80s, there is sometimes a connotation of like bouncing in a stretch. And so when you're doing a dynamic stretch, you want to make sure that you're not using force to go to or even past the end of range. So especially for people with arthritis where there may be joint instability, being mindful of where the end of range is and not pushing or adding force to the end of range. An example that might happen in yoga, for example, is when doing a twist, you can move through the range of a twist without holding on and pulling, adding force to the end of the range of the movement, but staying within your natural range in order to maintain it is more a characteristic of healthy dynamic stretching than, bouncing with force. Would you agree with that, Sabrena? Did I characterize that appropriately?
Yes. Okay. Sometimes we've heard that called ballistic stretching too.
Yes.
So the bouncing and the ballistic probably isn't the best option for people with arthritis.
Right.
Yeah. So that is how we do the warm-up exercise. In this way of dynamic. Early on, I thought it was the ballistic dynamic. What Steffany thought that was main. But yeah, dynamic stretching is what we do very gently with our warm-up exercise before we do our Tai Chi.
Perfect. All right. Well, let's move on to the next section. So now let's talk a little bit about workout plans and timing. So ideally, how many days a week should someone practice balance and flexibility exercises for better joint health and fall prevention? So how often and how long would you say?
Well, it's an hour is a really good time, but generally speaking, in terms of stretching, Tai Chi, balance, half an hour, 20 minutes is really good, especially if you're not comfortable to do 1 hour, and you can spread it out to 2 sessions. So let's say half an hour most days a week, 4 days a week, that would be ideal. By study, it shows that amount of activity really improve reduce your risk for diabetes, heart conditions, improve your immunity. Just about most health factors got better with that amount of activity. So, and then of course, if you can do more comfortably, like me, I do at least an hour every morning, and that is so enjoyable. And
Yes.
more effective.
So you actually do it every day yourself personally, Dr. Liu?
Absolutely. I did Tai Chi because of my arthritis. And it's not just so helpful, but it's so enjoyable. And if I don't do it for a few days, my arthritis played out.
Yes.
So it's a blessing in disguise. I do more.
Absolutely. I can agree with that because my mother actually has rheumatoid arthritis too. And so I would say the last 10 years or so, like she religiously, she gets up every day and does something. And when she doesn't, she can feel it. Her body lets her know. And I'm the same way, so movement is definitely the best medicine. I feel like, so yeah.
So I'll speak to dose for yoga, and then maybe Sabrena can talk about it from an exercise science perspective.
Yeah.
So in order to determine the minimal effective dose, right? That's what we would do for a medicine, is we want to have like the least amount to get the benefit that you're looking for, right? How little can you get away with and still experience the benefits? In order to do that, you have to have research that compares doses in order to see, well, what's the effect of doing it for this long, this many times versus this long and this many times. There is not a whole lot of research looking at the dose response in yoga. many of the studies of yoga, and I think this is similar with Tai Chi, they tend to look at 3 times a week for about an hour, because that seems to be what people are willing to do. And if you tried to do a research study and you said, you have to come into our research center and practice for an hour every day, you probably would get a whole lot of people dropping out of the study, and then you wouldn't be able to measure the effects. And so we want to balance what are people willing to do with kind of optimizing the effects. I can say from our research that when people did 2 classes per week plus practice at home in between, that they did have benefits by 1 month, that was enhanced by 2 months, that was even greater when they continued. But anecdotally, outside of the context of research, what I recommend instead of get on a mat for an hour every day is, and I think Dr. Lamb speaks to this as well, how do we incorporate the practices throughout your day so that it doesn't become something that you have to carve out an hour for, but it becomes part of the way that you live and move? So for example, when you're standing in line, can you notice your posture? Can you ground through the soles of your feet and lengthen through your spine? When you're in a meeting, can you notice whether you're taking full deep breaths? When you get up from your chair, can you do it mindfully? And can you think about engaging the quadriceps as you stand up? Maybe when you wake up in the morning in bed, you do some joint movements in order to, get the synovial fluid sloshing around and reduce stiffness. Maybe you do a relaxation practice in bed. Maybe you stand on one foot while you're brushing your teeth. So these are practices that happen. We call them yoga snacks, which, doesn't have to replace your routine. But I think that when they become habitual and they're part of life, then we're getting the benefits all of the time without having to think about, oh gosh darn, I didn't find time to fit in my practice today. So that's just another way of thinking about how these practices fit into daily life.
I love that. Yoga snacks. Thank you. Sabrena, did you want to add anything to that?
I would just say that the general public health recommendation is, a minimum of twice a week that you should be focusing on stretching, but honestly, daily, if that's your jam, it would be great to do daily and really just be mindful of how it makes your body feel, because it is possible to do too much and then you kind of dread it. But I think the small snacks are great.
I'll also add to what Sabrina's saying about, it being possible to do too much, especially when you're first starting out with any new routine. Try it and wait a day and see how you feel, and use that as, because sometimes we don't feel the effects of it until a day later. And so you may want to wait and notice, was that too much? Was it not enough? Was it just right? And then make decisions about how often and how much, because, there are the recommendations and then there's how you feel in your own body and what's going to work for you. And so finding the optimal dose for you as an individual is maybe a bit of a trial and error for each person.
Agreed. Okay, we have another question from the audience. So what are some exercises for cording? So this is scarring or connective tissue under the arm that can limit the range of motion. That's a really good question. Any recommendations, anything that comes to mind for someone with scar tissue?
That seems, if I were working with a client who presented with this problem, I would definitely speak with his or her physician.
Yeah.
And because that's a little bit outside of scope of my practice. So I would want to make sure that whatever we were doing was not going to exacerbate the current condition. So
right.
I'll have to tap out of this one, I'm afraid.
A lot of ladies who have breast cancer operation, they have lymphedema and scar tissues around this area. And there are a few pilot studies, and certainly many of our instructors has been teaching them Tai Chi for arthritis. and that because it's gentle stretching, and anecdotally, and the pilot study showed quite a lot of improvement in the range of motion, in the lymphedema, and make them feel better about themselves too.
Right, right.
I think it's important there to stay within the range of motion that's available given that scar tissue. So, in a yoga practice, for example, there are a lot of movements that suggest taking the arms up overhead. And whether it's because of scar tissue or it's because of a rotator cuff injury or arthritis in the shoulder, keeping the arms within a range that's available and comfortable. So, Sabrena was talking about the arm circles, for example, being able to mobilize that joint, but in a way that doesn't force or pull at the tissue that is limiting that movement is important. In addition to being sure to consult one's physician, of course.
Right. Absolutely. Okay, so last questions in this section before we wrap up. How can someone tell the difference between good pain and bad pain after mindful movement or therapeutic exercise? And what can one do to minimize post-workout pain? I know we touched on this a little bit, but let's just kind of wrap it up. Anyone want to weigh in on that?
The first, they need to talk to their health professional. That's a very individualized feeling, and I think like a health professional, exercise professional would be the person if they're not sure.
The difference, yeah.
So, if somebody is experiencing discomfort, then what it sounds like is soreness, right? Like, I think that the question is geared at when you're feeling discomfort the next day. And so one question is, where are you feeling that discomfort? And is it in the muscle? And then it's probably because you haven't used those muscles in a while. Anytime we do a new activity, we might experience some muscle soreness. And then you might want to wait a few days and make sure that the muscles recover before you engage in that activity again, which is different from an exacerbation of arthritis pain, which can absolutely happen if you do, too much repetitive motion. So if you're doing the same movement over again, which could be something like cycling, or if you do a whole bunch of sun salutations in a row and you do experience an exacerbation of your arthritis pain. And, it's also possible for people who have inflammatory arthritis to trigger a flare if you really overdo it. And then you're going to feel an exacerbation of your arthritis symptoms, which is why it's important to start off slow and gentle and try a little bit and see how that feels, and maybe try a little bit more. It's also really important that you breathe during exercise, because oftentimes we see in yoga that when people concentrate, they stop breathing. And if you're not breathing fully and deeply during the activity, then you're not able to fully oxygenate your tissues. You're going to end up more likely to have muscle soreness. And so, yoga, we try to coordinate the breath and the movement and say, okay, breathe in as you take the arms up, breathe out as you bring the arms down. I suspect that something similar happens in Tai Chi as well. So continually reminding yourself to keep breathing is going to not only reduce the likelihood of soreness, but it's also going to prevent you from going into a stress response during the activity. And if we're in a stress response, that's also more likely to exacerbate arthritis symptoms. So trying to maintain calm, ease in the body by breathing fully and deeply throughout the activity can be useful.
Absolutely. That makes perfect sense. So we've got one more question from the audience before we wrap up. What are some stretches for hand pain? Anybody?
Well, part of my arthritis is my hands. That's a common place too. And I think it's not just the hand stretch. Tai Chi stretch the whole body and move that life energy within you that help you to heal. So when I do my Tai Chi, I put a little bit more mindfulness in sending some healing feelings to my hands.
Mm-hmm. Like that.
It really depends on why you're experiencing hand pain, right? And where it is. You know, if it's tension and tightness in the hands from, you know, a lot of typing or that sort of thing, you know, it may be helpful to just give yourself a little massage of the hands and sort of, you know, loosen up those tissues. It may be bringing a little bit of movement in order to reduce the stiffness in the hands. There can be some stretching that can be helpful. So I would say it depends. But I actually, and maybe I can put it in the chat of the Facebook after the fact, but I have a couple articles that I can recommend that have some ideas about practices that you can do with your hands.
Thank you so much. Well, I believe that's all the time that we have for today. So I'd like to thank our guests again for such an enlightening discussion and for lending their time and expertise tonight. So thank you so much, Dr. Lam, Dr. Steffany, and Sabrena. Thank you all so much for your time tonight. And a special thank you to ACE, the American Council on Exercise, for helping make this event possible. Also, thanks to our viewers so much for joining us tonight. Take care and thank you.